Okay, so we're gonna get into concussions now. This is the first day of concussions. We're gonna spend quite a few days, probably the next couple of weeks on it, maybe even longer. The first video I usually always show with regards to the concussion is a video on an athlete who got injured back in 2005, I think it was. Um, and it might have been a little bit later, but he had a catastrophic injury. Um, from returning to the field too soon. So with regards to concussions, the biggest concern, the biggest approach we have as sports medicine professionals is the safety of that athlete not returning to the field too soon, to make sure that they have the adequate recovery time in order to ensure that they do not have a traumatic brain injury that becomes catastrophic. There is some there's a couple scenes in here that can be a little sensitive to people. So just if that is the case and you do see that you start to feel a little queasy or whatever, please feel free to either put your head down or let me know, or just step outside. Just let me know you're stepping outside so I can follow you. I don't think that's the case, but again, I just want to make sure I put that slight disclaimer out there for you. Here we go.
Life was good for Preston Plevrides as a senior at Marlboro High School in New Jersey. He was charismatic, handsome, captain and MVP of the football team.
Everyone looked up to him, kind of. I mean, that's kind of how he was around our school. Like, everyone knew him, everyone was trying to say hi to him.
He just was happy all the time. Always happy. He just had that aura.
What were his dreams in football?
He's going to get himself good enough and strong enough and fast enough to play somewhere. If it wasn't at the NFL, it would be in Europe.
In college, those dreams would come to an end.
And he'll take breaks back to midfield, and breaks now returning it over the 40. And there's an injured player down. So I did not like the looks of how I saw him lying there at that field.
October 4th, 2005, at LaSalle University in Philadelphia. Plevrides is a 6'2", 230-pound freshman linebacker. At practice, he gets injured in a helmet-to-helmet collision.
I remember him coming home that night, a little bit concussed. You know, you're kind of weary. You don't really know what's going on.
In a game 4 days later, Plevrides tells the LaSalle trainer his head hurts. The trainer sends him to the student health clinic where he is diagnosed with a concussion. But 2 days later, a nurse tells Plevrides he can return to play after sitting out one game. Was he symptom-free at that time?
No, he was never symptom-free. Not at all.
Why do you say that?
He always complained about headaches.
And how did he deal with it?
Advil, handfuls at the time.
Plevrides plays in 2 games without incident. Then on November 5th, 2005, with 2:42 left in a game against Duquesne University in Pittsburgh, he tries to make a tackle on a punt return.
He went down like a ton of bricks, and we hit the ground, and he was out.
Doctors, trainers, and coaches rush onto the field where Plevrides lay, convulsing.
He was just shaking. And then he kind of rolled over onto his back, and he just went completely limp.
I was worried then. Can't describe the look in his eyes.
And I think they're just gonna end the game right here, and I think that's a good decision.
It's hard to go play football after you do something like that.
The head coach and team trainer run to Mercy Hospital just a few blocks away. Assistant coach Phil Petit is in the ambulance.
He started to foam a bit at the mouth. At that point, he was starting to fade.
For 2.5 hours, surgeons worked furiously to save Plevrides' life. A massive blood clot is putting pressure on his brain. To relieve the pressure, the right side of his skull is removed.
This part was all pushed in because they had taken his skull off, so the brain was exposed. He was on life support.
He was laying there, tubes out of his head. He had tubes going down both nostrils. My beautiful boy was laying there.
Today, 24-year-old Preston Plevrides is the face of concussion and consequence. He struggles to eat, walk, and talk 4.5 years after his injury. Do you remember the hit that you took on the field? What do you remember about the Duquesne game? At least 55 high school and college football players have died of brain injuries sustained on the field since 1995, according to the National Center for Catastrophic Sport Injury Research. Preston suffered second impact syndrome, which occurs only in athletes under age 23 whose brains are still forming. It is a rare, often fatal injury that happens when a brain that hasn't healed from a prior concussion is jolted again.
The word concussion in Latin means to shake violently. Think about the brain as an egg inside an eggshell.
Mickey Collins, who has reviewed Plevrides' medical records, is one of the world's leading authorities on sports-related concussions.
If you have a blow to the head, that's sufficient enough to cause the brain to move inside the skull. A certain neurochemical called potassium is released outside of the neuron. At the same time, a second neurochemical, calcium, which is supposed to be outside the cell, it leaks into the neuron. And for some reason, a second blow during this period of metabolic crisis will set off a cascade of events that you can't turn back from. And that's when you see the massive brain swelling. I don't believe the second event would have ended up resulting in a catastrophic outcome if it weren't for the first concussion occurring.
Preston lived without a portion of his skull for 5 months. He would spend his 20th birthday in the hospital trying to regain the use of his arms and legs. After 9 months, he began moving around with a walker. In 2007, 2 years after the hit, he was exercising daily and starting to regain his speech. But Preston began having painful seizures, as many as 10 a day. So in July 2009, doctors disconnected the frontal lobe from the rear of his brain. The surgery left him barely able to move or talk again.
He was devastated. I remember him crying after his operation, saying nothing works, and he didn't expect it to be that bad.
Preston said to me he doesn't blame the game. The only thing Preston blames is lack of knowledge.
In 2007, the Plevrides sued LaSalle University and team trainer Bill Gerzebek for negligence. E60 obtained this deposition of Gerzebek, who was questioned about his evaluation of Preston 5 days after the initial concussion.
No orientation or memory questions, no recall questions.
No,
You did nothing to evaluate his mental status.
no.
The university has admitted no wrongdoing and still employs Gersbeck. But last November, LaSalle, which no longer has a football program, agreed to pay the Plevrides $7.5 million. In December, the NCAA began revising its concussion guidelines. On April 29, 2010, it urged schools to have a concussion management plan on file, requiring clearance by a team doctor before an athlete returns to play.
This case is significant because it's a wake-up call that you have to have a serious program with regard to head injuries.
At-home aides and Preston's parents care for him around the clock.
My name is Preston Plevrides.
5 days a week, he sees therapists who help him work toward one of his goals: to speak publicly about the dangers of playing with a concussion.
How important is it for you to have people understand your story and learn from your experience?
Very,
Very important. Yeah.
because I don't want people to end up like me.
It's a young man that's been through a heck of a lot.
It's now February 2010, and all eyes are on Preston Plevrides. A concussion awareness event at a New Jersey hospital. In the audience, high school trainers, coaches, his therapists, and family listen to his story.
You're good.
What was the message in your speech?
My son survived, but look at his life right now. My son is the face of consequence of not understanding the symptoms of a concussion.
What has been the hardest part of all this for you?
So every game that I'm on the sideline, and there's a player that comes to me for testing on a concussion, I think I don't ever want this player to end up being like him. So it's a really helpful reminder for me, although it's such a negative consequence and negative story, to really help spearhead good positive testing, just being able to be an individual that can look for the signs and symptoms of a concussion, do the right testing, and make the difficult decisions sometimes for those players, and that is not letting them return. So when we look at a lot of these functions, right, of the brain. Trying to go back to and we look at the first set: conscious thought, sensations, intellect, memory, complex movements, balance, coordination, repetitive movements, sensory information, emotions, autonomic function, hormone production, visual information, sight, hearing, reflexes, consciousness, smell, vision, eye movement, sensation, hearing, balance, taste, speech, neck movement of the arms, back, shoulders. All of these potential, all these functions that we have. And if I go back to the balance and equilibrium, the proprioception, sitting and standing without assistance, even the hypothalamus, emotions, visceral processes, heart rate, blood pressure, respiration, digestive function, sleep cycles, subconscious control, movement, pleasure, pain, rage, emotions, behavioral drives, hunger, thirst, satiety, all of that. When we think about it, there are so many normal functions that we can see that may not be so normal. When we test, it's really easy to see an individual who's not functioning correctly when we do all the tests that you're about to learn. So I'm going to hand out a SCAT 5. It looks like this. And I'm going to cover what that's about, and it's going to help us actually go through all the testing for concussion. So I'm going to give that to you next. So I'm just gonna take you through this. Just gonna summarize the things that you're going to learn how to do, and we're gonna do it from the SCAT 5. So the SCAT 5 is a assessment screening tool for doctors and trainers to utilize to determine whether there's a concussion that's occurred. So what you would do is you would put the name of the patient on here. You would put their date of birth, you'd put their address. You'd be the examiner, for example, if you're a doctor or a trainer, date of injury and the time. The SCAT 5 is a standardized tool for evaluating concussions designed for use by physicians and licensed healthcare professionals. The SCAT 5 cannot be performed correctly in less than 10 minutes. It usually takes a good amount of time to complete it. We'll take you through specific parts of it, piece by piece. And then you'll have all of the components to it. And then once you have all the components to it, you learned it piece by piece, then you'll do a complete SCAT 5 on a mock patient, like a partner. So immediate or on-field assessments. So what we look for initially, which are red flags, we look for, is a person having double vision? Do they have a seizure or convulsion? Do they have loss of consciousness, deteriorating conscious state, which means, yes, they're awake and alert and they're answering your questions. And then in 5-10 minutes or even beyond, they can't answer your questions anymore. For example, vomiting after a head injury, increasingly restless, agitated, combative state, severe or increasing headache, neck pain or tenderness as well is something. The red flag is basically saying you're definitely not going back in, and we need to potentially call emergency medical services for that. So what we look for initially, observable signs. So was it witnessed or observed on video? So did we see it? Did we see them lying motionless on a playing surface? Even if it's for 10-15 seconds. Did we see them get up and stumble? Did we see them having poor balance? Did we see them having gait difficulties? Did we see them having motor incoordination, where their arms and hands and just didn't look normal? Were they disoriented or confused? Did they have an inability to respond appropriately to questions? So if I ask an athlete, where are you? And they can't respond correctly, they don't know where they're at, they say something else, or they say somewhere else, or they can't speak fluidly. We go back to all of the functions of the brain that we spoke about. Is speech normal? Are they following your finger back and forth? Are they walking normally? After they got hit or after they went down or whatever it might be and they got up, did they look normal when they were walking? Did they have a blank or vacant look? So meaning if I'm asking an athlete a question, are they just staring at me and not answering? Or do they just look stunned? So these are all observable signs. And then facial injury after head trauma. Does it look like they have a wound, an open wound, open cut, blood? Does it look like part of their face is swollen, a part of their head is swollen? Does it look like the back of their head swollen, wherever they may have gotten injured at potentially? Step 3, memory assessment Maddox questions. We'll begin to start asking them questions to see if they're oriented correctly. We ask, what venue are we at today? Which half is it now? Who scored in the last match? What team did you play last week or game? Did your team win the last game? So we're now asking basically memory-based questions. There's also what's called a Glasgow Coma Scale. this begins to be starting of the testing that we'll do, and we'll run through this with you. And we score it. So this is also done in hospital settings as well. Best eye response. Did they have their eyes open after they got injured? Were they opening their eyes in response to pain? Or did they open their eyes spontaneously? You all would be considered a 4 because all of our eyes are open spontaneously. No verbal response, a 1, all the way to oriented, which would be a 5. So if I asked a student, one of you in here, you know, how's your day going today? It's not a SCAT 5 question, but how's your day going today? And then he says, it's going great. Thanks for asking. Well, he looks oriented. He's responding correctly. We would give that a 5. Best motor response. If I said, can you touch your finger to your nose? Yeah, you can do that. Obeys commands, we give that a 6. So then we score that, E plus V plus M, and we would give it a score. So not oriented, no motor response is a 1. No verbal response is a 1. No eye opening is a 1. So that would be the worst case scenario. So that would be only a 3 out of 15. So there's quite a few tests. Cervical spine assessment will cover. Athlete background has just a basic general history on his history diagnosis or history of head injuries, migraines, things like that. And then we start to do more testing, symptom evaluation. What are they feeling right now? Do they have a headache? Do they have neck pain? Are they nauseous, vomiting? Do they have blurred vision? Are they experiencing balance problems, sensitivity to light? So they answer these questions. We hand them the form, and then they will circle basically from a 0 to a 6 on how they feel. Then we move on to orientation. We start asking questions like, what month is it? What's the date today? Day of the week, year, what time is it right now? We give them either a 0 or a 1. Did they answer correctly? No, they get a 0. Did they answer correctly? Yes, they get a 1. Immediate memory, we'll give them 5 words or 10. Usually we do 5 with regards to the curriculum here. We give them 5 words: finger, penny, blanket, lemon, insect. We asked them to repeat those 5 words in any order. We do it at three times. Can you repeat the words again? Finger, penny, blanket, lemon, insect. They give it to us another time. And then the third time, can you repeat it again one more time? And then we score it out of 5. Trial 1, trial 2, trial 3, we score it. They did all 5 words, all 3 trials perfectly. They would then get a 15 out of 15. We go to numbers digit backwards. This is also concentration. This is a list of numbers. We go 3 numbers first, then 4 numbers, then 5 numbers, then 6 numbers. So I would ask an athlete, can you repeat the words in reverse order? If I say 493, you would say 394. If they can do it correctly, they get a yes. And they would get a 1. If they did it incorrectly, they would get a no. Then you repeat, have them do the test again with 3 different numbers. If they get a yes, they get a 1. If they get a no again, they get a 0 for those 3 numbers. So we'll cover that. Then you go to 4 numbers and then 5 numbers and then 6 numbers to get that score for that test. Then we're gonna go to months in reverse order. That's really a straightforward test. Can you repeat the months in reverse order, starting from December? And then if they get them all correctly and with no pauses, they get a 1. If they make one mistake, or they flip the months in order, or they skip a month, or they can't remember the months, or they pause too long, or they say, I can't do it, they would get a 0. We go down here to neurological screen. We would give them a few tests, side to side eye movement test, passive cervical spine movement, finger to nose test. Can they move their head up and down, side to side without double vision, things like that. We would do a tandem gait, and then we would do a balance examination as well. Can they stand on one leg? Can they stand with 2 feet, 1 feet behind the other? Can they stand normally with 2 legs down? And then we do a delayed recall. We go back to the five words that they did before, and we'd say, hey, remember those 5 words that you did? Yeah, I asked you to remember 5 minutes ago. Can you repeat those again for me? And if they can say all 5, then they get 5 out of 5 or 10 out of 10. If they make mistakes on it, they can only do 3. Then they would, you would put down how many words they remembered correctly. And then you give a decision. So whoever does it would give the decision, symptom number, orientation. We'd score all of it here, date and time of injury, and then we would say, is a concussion diagnosed? Yes or no? And then at that point, we would write some notes down here, notes down at the bottom, at the end. We would give our clinical notes here. And then as a practitioner, you sign it, patient's name, date, time of injury, date, time of medical review, and healthcare provider. And then this would go in that patient file, athletic file, or patient file if you're a clinician or whatever it might be. Okay, so that's the SCAT-5 summary, all of it together. And then now what we'll do is we'll start to individualize smaller areas of it, components, and then we'll build upon it.